25 million Americans suffer from asthma each year. This is 1 in 5 Americans. Of the 25, 9 million of them are children, making asthma the leading chronic condition in children. Unfortunately, these numbers are still increasing across all ages, genders, and racial groups. Although asthma cannot be cured, with your help you can reduce your child's symptoms and better manage their disease. Here at C.A.B.A Pharmaceuticals, we propose an asthma action plan called Combination Air Vent and Bronchodilator Asthmapolis, also known as C.A.B.A. This includes using both a daily inhaled powder drug called Air Vent and an emergency inhaler that uses a quick relief drug paired with GPS technology, Asthmapolis. This system integrates both controller and rescue medications for preventative as well as fast-acting care to prevent and relieve asthma symptoms. The goal of this combinational drug regimen are to reduce asthmatic attacks in children and to better prepare them to manage their disease. If children learn how to treat and manage their disease early on, they will experience fewer asthmatic symptoms later in life. The first medication that controls symptoms of asthma uses the drug piperacillin, commercially known as Air Vent, which is an IL-4/IL-13 antagonist. In this form of treatment, medication is dispensed in a powder form, different from the conventional inhaler. This medication is a daily treatment designed to be taken orally once or twice a day as prescribed. During asthma, environmental triggers cause an abnormal release of cytokines IL-4 and IL-13 from T helper type 2 immune cells. These cytokines have been shown to cause inflammation of the lungs and other inflammatory allergic reactions. This process is believed to be one of the most important pathways in the pathology of asthma with patients living with moderate to severe asthma. Air Vent prevents these pro-inflammatory responses from occurring.
When an allergen such as pollen or dust mite is inhaled, it will be taken up by the mucous membrane to bind to an antigen-presenting cell, also known as the APC. The APC will then present the antigen to T helper type 2 cells, which will activate B cells to release IgE antibodies with the help of cytokines IL-4 and IL-13. The antibodies will accumulate over the surface of the mast cell. Mast cells have granulations that contain mediators such as histamine and leukotrienes. With the exposure of a second allergen, the allergen will bind to the IgE antibodies on the mast cells. A cross-linking will cause the release of histamines to bind to H1 histamine receptors located on the bronchial muscles. This leads to muscle contraction, vasodilation, and edema. The bronchial airways will narrow, causing limited airflow for the individual. In addition, the increased vascular permeability will cause fluid to escape the capillaries into the tissues, leading to a runny nose and watery eyes. Using the drug Air Vent, this process would not occur. IL-4 and IL-13 cytokines would not be released, leaving the mast cell bare from IgE antibodies. Because of this, the allergen would not be able to interact with the mast cell in order to induce an inflammatory response.
The second form of treatment is a beta-2 antagonist bronchodilator inhaler. This medication is fast-acting and will be used to relieve current symptoms of asthma to prevent an asthmatic attack. A unique feature of this device is the Asthmapolis technology. The Asthmapolis sensor sits on top of the inhaler. It is made up of several components that all work together to help track your medication use for you. With the use of the GPS technology, the sensor can track time and place that you have used your inhaler. This aids understanding triggers that can lead to an asthmatic attack. Through the pairing of both drug treatments, your child will be able to combat the symptoms of asthma and increase the capacity for proper respiratory functionality. While current medications are effective, they are not all-encompassing, to include preventative and emergency care. Since asthma is an inflammation of the respiratory tract, this combination of drugs will combat the onset of asthma. It will do so by blocking the chain of events that lead to an asthmatic attack. This attack is a combination of bronchial inflammation and overproduction of mucus, which can be seen in the following video.
Asthma is a respiratory disease involving the inflammation of the bronchi in your lungs. Under normal breathing, air travels through the nose and mouth, through the pharynx and larynx, through the trachea, and into the bronchi to reach the lungs. In asthma, the airways are oversensitized to environmental stimuli which includes pollen, dust mites, animals, and other causes. If asthma is triggered by one of these stimuli, the individual is said to be diagnosed with atopic asthma. People with atopic asthma can experience many different symptoms, such as wheezing, shortness of breath, chest tightness, and coughing.
that can all result in an asthmatic attack.
During an asthmatic attack, a trigger causes the airways to become inflamed and the surrounding muscles to contract. An excess amount of mucus is also released, causing a constriction of the airway. This results in a decreased amount of airflow to the lungs.
While asthma cannot be cured, it can be managed through the use of C.A.B.A. This combination of drugs will help parents better manage and monitor their child's asthmatic symptoms. If you think this drug is right for you, please contact your doctor or visit us on the web at tlkpharmaceuticals.com.